So there's three criteria. Criteria number one, do I get any discomfort in my chest with activity? That makes me feel nervous. So I'm running down the street, I'm walking, I get this something in my chest. And classic angina, it's not a pain, doctor, it's a heaviness, it's a weight on my chest. And I get a little bit sweaty potentially. And the third is duration. It lasts somewhere between 30 seconds to 10 minutes. So typical angina has three features. One, caused by exertion, relieved by rest. Number two, a weight, a pressure sensation in the chest. And so when you have these features of exertional tightness in your chest that lasts for a few minutes, it gets better when you rest. That's typical angina. And historically, the probability of that being blocked arteries was about 90%. But you have to decide the context of that. So if you have a high LP(a), you're overweight, you're diabetic, you have hypertension, you don't take your pills properly, and you have high cholesterol, you lost 30 years of life. And so when you're 30, your artery age is that of a 70-year-old. And so you're in trouble right now. Now, heart pains can be all sorts of different strange places too, but that's classic angina. And that's why we use the treadmill, the stress test. You walk on the treadmill, does it reproduce your discomfort? Very helpful.
As a follow-up, when what you want to see is that it repeats itself, right? So when it's repeating yourself, going up the stairs with the same amount of walking, you get the same sort of chest pain. It was not just a one-off after a certain meal, right? And as you mentioned, there's reproducibility, and so your confidence goes up that it's heart-related or not, if it's it doesn't have those features that we
Yeah,
mentioned.
it's a great point. But also too, these are not fixed pipes as well. These are
Yeah.
pipes that have that have different tones, your blood pressure, your stress level. And so it may not be reproducible at the exact same workload because depending on your blood pressure and how much spasm you have on that artery at that moment in time may change. But you're right. If you have heart pain, it should be happening on a regular basis. We've also learned that we have very small vessels. We have the microcirculation, we have spasm. So, and that's the discussion for a different time. But there are other forms of heart disease to think about. But these are large vessel blockages that we think about fixing, or more importantly, preventing or treating with medical therapy. We have really good medicines. In fact, if you look at people historically who go for an angioplasty compared to those who are on medicines, initially the angioplasty may make you feel better. It will increase your risk of having a heart attack in the first couple of years, but also as time goes on, by in 4 years, there's not much difference between medical therapy or angioplasty for relief of chest pain or bypass surgery unless it's severely blocked.